Dear friends, welcome to the show Talk with Your Doc. I'm Dr. Prashant Jani, and with me is Dr. Adrian today. He is oncologist at Thunder Bay Regional Health Science Center. Today we are going to talk about breast cancer. Breast cancer is the second most common type of cancer after skin cancer in women. In US in 2016, 246,000 patients are diagnosed with the breast cancer, out of which 40,000 patients died with the breast cancer. In Canada in 2015, 25,000 patients diagnosed with the breast cancer, out of which 5,000 patients died with the breast cancer. It is the statistics say that 1 in 9 women will get a breast cancer in the lifetime. So breast cancer is quite a significant disease, and not only women but men also can get breast cancer. So today me and Dr. Adrian Chan are going to discuss about the breast cancer. Welcome, Dr. Chan.
Thank you.
Thank you for coming for the show, Talk with Your Doc. And in our practice, day-to-day practice, we see a lot of biopsies and you see a lot of patients with the breast cancer. So if somebody's family history is a breast cancer, is that a risk factor for somebody getting a breast cancer?
It is. Having a close relative like a sister or mother or daughter who has breast cancer does increase your risk of getting breast cancer yourself. And if you have two close relatives with breast cancer, the risk is even higher.
So if my family history is positive for breast cancer, what are the tests we can do to diagnose this at an earlier stage?
Well, the usual screening test to check for cancer when you are well and don't have problems or symptoms of cancer is, for breast cancer, usually a mammogram.
And how about the BRCA mutations? Is that a risk factor for the family history?
Well, about 5 to 10% of breast cancers are hereditary genetic disease, where people are born with a mutation in a cancer-related gene that's in all the cells of their body, and that they can pass on, to their children, and that significantly increases the risk of getting breast cancers. Most of those genetic mutations are in the BRCA1 or 2 genes, and sometimes testing for BRCA1 or 2, or at least some genetic counseling, may be indicated. If there is a very strong family history of breast cancer, or for example, if there is a history of someone getting breast cancer in the family at a very young age, like less than 40, or at least less than 50, or if there is a young woman with bilateral breast cancer in both sides, or if there is a family history of both breast cancer and ovarian cancer. So some examples.
So BRCA1 and 2 mutations are if they are present, then it is a risk for the breast cancer as well as the ovarian cancer. So
That's right.
Is this BRCA1 and 2 normally present in the normal patient, normal people? And what is the role of BRCA? What do they do in our body?
These genes are involved in DNA repair. They repair DNA damage. Right? So if you're deficient in one of these genes, you're more prone to developing genetic mutations. Right? You can acquire, these BRCA mutations in a cell in your body, right? Through, maybe perhaps due to exposure to things in the environment or things in your diet that causes changes in our DNA, right? But that is different than being born with this mutation that is in, all the cells of your body. If you have that genetic predisposition, there is a much higher chance that you will get breast cancer than the average person.
So average person does have a BRCA1 and 2, but they prevent against the cancer. They prevent the cancer in the patient. But if they are mutated, then they lead to the cancer probably.
That's right. Yeah. I mean, anyone can have changes in their cells that can lead to cancer. Usually it's multiple changes over time. But if you're already born with this genetic predisposition, you're already at a higher risk
so
or predisposed.
So how can we test this BRCA1 and 2?
It's usually a blood test.
Blood test. Okay. So is there any genetic counseling required before somebody does this blood
Yes,
test?
you should be referred to a genetic counselor, and they will review your family history of cancer
Right.
and advise whether or not it's appropriate for a person to have BRCA1 or 2 testing. And then it's a
So
blood test.
if somebody's family history has a breast cancer, the first degree relative has a breast cancer, in addition to mammogram, does BRCA1 and 2 testing help those patients to screen for the breast cancer too early?
You wouldn't normally do BRCA1 or 2 testing as a sort of a screening, you know.
Right.
Yeah, it is usually something that is considered based on, you know, high risk, you know, features, like, as I mentioned before, including strong family history, and you know, upon the you know, counsel of a genetic counselor.
Now there is a people understand that oral contraceptive pills causes breast cancer. Is that true?
There is some increased risk with using oral contraceptive, you know, medication, but the risk decreases with time. So, you know, if it's been more than 10 years since you have had the oral contraceptive pill, then there's not a significant risk.
Does wearing a bra causes breast cancer?
That has not been clearly shown. There's been some, you know, studies done, and I think a book written suggesting that might be so, but the research does not really confirm it.
We hear a lot of internet rumors and emails.
It may be more of a rumor, or it may have to do with the fact that women with larger breasts, or women who are obese or overweight, may have larger breasts and may be more likely to, you know, not wear a bra as often, and we know that being overweight or obese is a risk factor for breast cancer.
Now, does abortion causes breast cancer?
That has not been confirmed by research either.
Right. So there are lots of myths about the breast cancer. One of the myths is does diet or the lifestyle factors, does it causes breast cancer?
There are some factors, risk factors for breast cancer that can be modified, and so there are some lifestyle things that may increase your risk of getting cancer. One is weight, as I said, being overweight or obese increases your risk. Activity also has been shown to be helpful in reducing, you know, risk of breast cancer, moderate activity. And also alcohol consumption as well has been associated with increased risk of breast cancer.
Smoking, is it?
There has been a little research that suggests that there may be a slight risk of increased risk of breast cancer associated with smoking, and some limited evidence suggesting possibly secondhand smoke as well.
Right. One of the article I read, they said about coffee and the breast cancer. There's possible risk, and people who have been diagnosed with the breast cancer, they drink a lot of coffee, and they say that if you reduce the consumption of coffee, possibly there might be reduction in the breast cancer risk. That is one of the minor factor probably.
Right. There may be some minor factors that are, you know, suspected but not, you know, strongly confirmed.
Yeah. Yes. Thank you, Dr. Chan. Please stay back, and we'll get back to you after a short break. Thank you. Welcome to the show Talk with Your Doc, and with me is Dr. Adrian Chan. Thank you, Dr. Chan. We were just talking about various risk factors for the breast cancer. One of the risk factor is the breastfeeding. Can you please tell us about the breastfeeding and the relation with breast cancer?
There's some indication that breastfeeding may reduce the risk of breast cancer slightly if you breastfeed for a total of 1.5 to 2 years. It has to do, it's believed, with exposure to estrogen in the body, right? There are various hormonal risk factors that are associated with breast cancer. That includes the breastfeeding, but also starting menstrual periods at an earlier age, like less than 12, or having late menopause, the ending menstruation at a later age, at greater than 55, because the theory is that those factors allow for a woman's body to be exposed for a longer period of time to estrogen, which is a hormone in the body that can influence the growth of breast cancer cells.
So now postmenopausal women, they do receive estrogen supplementation or hormone supplementation. Is that hormone supplementation treatment in a postmenopausal period, is that a risk factor for breast cancer?
Some research has shown that menopausal hormone therapy, hormones that are taken to help relieve some menopausal symptoms, can be associated with increased risk of breast cancer through some studies, including major research through the Women's Health Initiative. They showed that in women who took combined estrogen and progesterone hormone therapy, did have an increased risk of breast cancer. Though women who took only estrogen alone did not have as increased the risk of breast cancer. But the estrogen therapy alone is usually used mainly for women who have had hysterectomy, because the estrogen alone in itself can increase the risk of endometrial cancer, cancer of the womb or uterus.
Right. So we talked about all these risk factors for the breast cancer. So now how can we prevent the breast cancer? How we can detect it at an earlier stage and prevent it? So you talked about prevention by modifying the risk factors like lifestyle modifying factors or reducing the smoking, alcohol, as well as screening if patient's family history has a breast cancer. And we talked about BRCA. Can you please tell us about the clinical features? How can patient know that he or she has a breast cancer?
Sometimes you don't have any symptoms with breast cancer, and it's detected on screening. In a woman who doesn't feel any symptoms, they're well, but the mammogram may show a suspicious finding in the breast. So sometimes you don't have any symptoms, especially if you're being screened. But otherwise, the most common symptoms are some changes in the breast, like commonly feeling a lump in the breast that is persistent, that doesn't go away or reduce in size with time. It may be firm, irregular. There may be some tenderness, but often not a lot of pain.
Is there any discharge coming from the breast? Suspicious?
Well, many things can cause discharge from the breast, from the nipple, and most of the time it's not related to cancer. But sometimes you can have breast cancer associated with discharge from the nipple, especially if it comes just spontaneously and maybe with some blood.
And if the breast tissue is very dense, then it is very difficult to feel the lump or the bump. Then in that case, what is the method to diagnose breast cancer? So if a patient has no signs and symptoms, but she is like 40 or 42, then what is the mammogram? How does it help to diagnose the breast cancer at earlier stage?
If a woman is healthy and does not have any concerning symptoms, then the usual screening for a woman is mammogram.
So can you explain us about the mammogram a little bit? What is it? What sort of procedure it involves?
It's basically an X-ray where they take images of the breast. They compress the breast between two X-ray plates. They take generally two sets of images, one where they compress the breasts, in this direction, and another in this direction. And these days it's commonly done using digital imaging, technology, and it looks at abnormal breast tissue, right? Or can identify some abnormal breast tissue.
So it can diagnose, the mammogram is like an X-ray test which can diagnose abnormalities in the breast at a very early stage, right?
Right, yeah.
Like so along with the mammogram, is there any other procedure like biopsy also are done along with the mammogram?
Sometimes if the findings on the mammogram are not clear, they may use ultrasound to further evaluate,
Right.
To check if the finding is solid or fluid-filled, a cyst. And then if there is something suspicious, found on mammogram and or ultrasound, then often a biopsy with a needle, often guided by ultrasound or perhaps by mammogram-like imaging, is done.
Now, what are the recommendations after what age and how frequently one should get mammogram done?
The current common recommendations are for women of average risk for breast cancer to have screening with a mammogram about every 2 years between the ages of 50 and 74.
Okay.
Below the age of 50 for average risk women, it's not as clear if mammograms are beneficial.
Okay.
And above the age of 74, there's also less research to show if it's helpful. But many women who are of that age or older and are generally fit, can still talk to their family doctors and it would be reasonable to consider them for mammogram screening as well. If women are younger, between 40 and 49, but have high risk, features like strong family history, or are known to be, BRCA1 or 2 mutation carriers, then some screening is recommended earlier.
Yeah. So breast cancer is not a disease of old age. It can happen in young age also, like between 30 and 40 also. So if a family history of breast cancer, if somebody in the family has been previously treated or diagnosed, or there is a history of BRCA1 mutation, screening with mammogram earlier is helpful in young patient, right?
Breast cancer can occur in a wide spectrum of ages, wide range of ages. Age is a risk factor for breast cancer, so as you get older, the chances are more likely that you will get or the breast cancer. And younger women can still get breast cancer even in their 40s or even in their 30s.
30s, yes.
Young women like that, often it raises the suspicion that maybe they do have a BRCA1 or 2 mutation, and those young women would often be referred for at least some genetic counseling.
Right. So even though age is a risk factor, everybody should watch carefully. And so does self-examination help in diagnosing the breast cancer at earlier stage?
I think in the past, self-breast examination was recommended a lot. When they do research on it, it's hard to prove that regular self-breast examination definitely decreases the rate of death from breast cancer. I think what is important in general is to have some, awareness of one's body, right?
Yes.
To kind of have a general sense of what is normal and what is not abnormal, as in general, more than specifically having to do a formal breast examination. Just to have the general awareness of your body and to be able to seek medical attention if there is some changes that you feel are unusual.
Thank you, Dr. Chen. We'll come back after a short break. Please stay back. We'll come back. Thank you. Welcome back to the show Talk with Your Doc. With me is Dr. Adrian Chan, and we are talking about breast cancer. Thank you, Dr. Chan. We were talking about mammogram and the screening test for the breast cancer. What is the role of MRI test in the breast cancer detection?
MRI is often used for screening of women who are felt to be at high risk of getting breast cancer. For example, the women who are carriers for BRCA1 or 2 mutations. Research has shown that using MRI of the breast in addition to mammogram, increases the rate of detection and of breast cancer compared to mammogram alone.
So MRI is more sensitive than the mammogram itself.
It can be helpful and maybe more sensitive, I think, especially often in younger women where they have more dense breast tissue,
right.
And dense breast tissue decreases the sensitivity of mammograms.
Yes. So we do biopsies along with the mammogram, ultrasound, or with the MRI. And once the biopsy comes to the pathologist's desk, then we as a pathologist, we diagnose what type of cancer it is, whether it is an in situ cancer, which is like a locally confined cancer, or whether it is an invasive cancer, which has possibility of spreading to the different parts of the body. We also classify them as a lobular and ductal type of cancer. And then we do various types of tests on it, like hormone receptors, like estrogen and progesterone receptors. And one of the tests we do is HER2/neu test. And then we also do Oncotype DX test. So can you please tell us about Oncotype DX?
Oncotype DX is a gene expression assay. What it does is it measures the varying levels of expression of a group of cancer-related genes. And this information can be used to assess the risk of recurrence of a breast cancer. The test is often done in patients who have an earlier stage breast cancer that has the hormone receptors for estrogen and or progesterone and has not spread to lymph nodes. And it's often helpful for a physician in assessing further the risk of the cancer coming back to help them decide for example, whether the risk is great enough to recommend patients having additional chemotherapy after the surgery to reduce the risk of the breast cancer returning, right. Or if the risk is low enough for them to just recommend anti-estrogen, anti-hormonal therapy alone.
Right. So once we diagnose the patient with the breast cancer, and a pathologist like myself will send you the report, that patients has estrogen and progesterone receptors positive invasive ductal carcinoma. So what do you do next once this report of biopsy comes to you?
Well, there's another receptor that is also helpful in assessing the risk of recurrence of the breast cancer, and that is HER2/neu.
HER2/neu,
which is a mechanism in the cancer cell that also can drive the growth of the cancer. And in approximately 20 to 30% of breast cancers, it is overexpressed. There's more of it than normal, and that increases the risk of recurrence of the breast cancer. Right. Women with HER2/neu overexpression positive breast cancers are often recommended to have chemotherapy plus a anti-HER2/neu antibody treatment called trastuzumab or Herceptin to reduce the risk of the cancer coming back.
Right. So now the surgical options, what are the breast conservative surgery, simple mastectomy or radical mastectomy with lymph node dissection? So who are the patients who get breast conservative therapy?
Breast conserving surgery with, say, a lumpectomy is these days often preferred for most breast cancer patients, as long as their breast cancer is not too large, right?
So what is the size limit for that? If somebody wants to preserve the breast and remove the lump, what is the size limit where they can go for?
Well, it's not necessarily just a strict size limit for all patients. It depends on the size of the tumor, but also the relative size of the breast as well, right? For breast cancers that are considered fairly large, like locally advanced, and these may be breast cancers that are, say, 5 centimeters or greater.
5 centimeters.
Often, it's difficult to do surgery initially, and so people will be treated first with some anti-cancer treatment, chemotherapy, and then
they go for the surgery.
And then have surgery. But many breast cancers that are smaller. And maybe in the range of 2 centimeters or less, often can have surgery with a lumpectomy. And then followed by, in addition to some sampling of the lymph nodes in the armpit to check for spread of the cancer there. and then after that, that breast conserving surgery, they would have radiation to the rest of the breast at a later point.
Right. So breast conservative therapy, say somebody undergoes breast conservative treatment, surgical treatment, removal of the lump and the lymph node. So there are two types of lymph node surgery, sentinel lymph node and the axillary lymph node dissection. So can you please tell us about advantage of sentinel lymph node biopsy?
Sentinel lymph node biopsy is basically sampling the first one or few lymph nodes that cancer cells would be more likely to, pass through if they travel, right? And it's often done to to save people from having to have a full axillary lymph node dissection where they remove a lot of lymph nodes.
So that full axillary lymph node dissection has associated problems. That's why we do this.
Right. It's often can cause swelling of the arm, lymphedema, which can be bothersome and impair one's ability to function with their hand. Yeah.
So sentinel lymph node, by removing one or two lymph nodes, if those are negative, the likely that other lymph nodes are negative, right? So it prevents the radical surgery and the morbidity associated with it. So sentinel lymph node is a good procedure, and the chances of it being detected are 99%. Is that right? So 99%, if the sentinel lymph node is negative, the chances are that the other lymph nodes are also negative.
That's right. If there are no sentinel lymph nodes, involved with cancer, the likelihood of more lymph nodes being involved is felt to be low enough that they don't need to have a full axillary lymph node dissection. And in fact, these days, often if you have a tumor that's not very big and just one or two sentinel lymph nodes involved with cancer, then you may not need more lymph node surgery as well.
Right. Now we talked about the treatment options. Now what is the survival of the patient with the breast cancer once he or she has been diagnosed with the cancer?
Well, the survival depends on the stage of the cancer, right? The stage is a description of, in general, how extensive the cancer is in the body. There are in general 4 main stages, with 4 being a situation whenever the cancer has spread to other parts of the body, other organs like lungs or liver or bone. Unfortunately, those breast cancers are not curable. Right?
Stage
can
4
be treated, but not curable. But stage 3, 2, and 1 are curable, and the lower the stage, the higher the risk, higher the likelihood or chance of being cured, with a fairly good chance of cure for stage 1 or stage 2 breast cancer.
So early diagnosis is the best way to fight against the breast cancer, and reducing the risk factors, lifestyle factors, and early screening methods like mammogram will be really useful to reduce the incidence of breast cancer in the society.
Yeah, I agree. Prevention with these lifestyle changes, like avoiding too much alcohol, avoiding smoking, and regular exercise,
weight reduction,
and, having a good healthy weight, and perhaps a diet that's lower in fat and rich in lots of fruits and vegetables. These things may help prevent breast cancer and other cancers. And then in addition, some screening tests, checking for cancer when you're healthy, like with the mammogram for breast cancer, can also potentially help catch the cancer at an earlier stage where the chance of cure is more likely.
Thank you, Dr. Chan. Thank you for coming to the show.
You're welcome. My pleasure.
Appreciate it. Please come back for the next edition of the Talk with Your Doc show. We are going to talk about the skin cancers. Thank you so much.